All right. So how do you diagnose temporomandibular joint problems? Of course, I've, over the years, taken thousands of MRIs and CT scans and regular x-rays, but really it's come down to the point, once you understand the problem itself, the diagnosis is simple. First of all, going back to the symptoms, you ask the patient the litany of, do you have these symptoms? And the average patient will come up with 3 or 4 or 5 of them, sometimes all of them. That's just a red flag. That does not make your diagnosis. If they have symptoms, that just gets you interested in that they may have temporomandibular joint problems. The defining factor in determining whether they actually have the problem is to do a little mechanical maneuver. It's very simple. You stand behind the patient with your fingers over the jaw joints, ask them to open wide, and put pressure inside the socket. As the ball comes out of the socket, your fingers will go inside the socket, and as it opens up, put pressure inside the socket and ask them to close their mouth. If they have inflammation in that joint, it's going to hurt. Most of the time, it's going to hurt like heck. Patients will respond very aggressively in pain, and you've made your diagnosis. And all you know now is that you have the common denominator. There is inflammation in the joint, and because of that, you have temporomandibular joint. By definition, inflammation in the joint is temporomandibular joint disease. So what's important to know? Does the joint hurt when you put pressure on it? That's the most important. How many of the symptoms are present? How long has the problem been present? You want to know mainly to document what you can expect as far as degree of damage within the joint. I've had patients all the way from having joint problems for 6 weeks all the way up to 40 years. How does the problem affect the life of the patient? This is very important. I've had hundreds of people who can't work, can't go to school. I've had a couple of people threaten divorce from their spouse. I have had several ladies who've taken so much pain medicine that they've either rotted out their liver or rotted out their stomach, having to have a gastrectomy. One patient's on a liver transplant list right now because she took so much pain medicine. It was the only solution she had for the pain of the temporomandibular joint that she overdosed and rotted out her liver. And is there a history of locking? We haven't talked much about locking, although it is one of the extreme symptoms of jaw joint problems. As the ball comes out of the socket, the cushion starts to get loose. When the cushion gets loose, it comes all the way out of the socket, and when you go to open, you bump into your own cushion. You get halfway open through the rotation. It won't translate, so you get halfway open and you're stuck. You're not going to get open the rest of the way until the cushion clicks back. When the cushion can't click back at all, then it's permanent, or it can be transitory where the cushion will click back and you just get locked temporarily. But it's one of the last symptoms that you're going to see with a totally degenerating joint.